All right, let's go ahead and get started. Thank you so much for joining us here on Zoom, or if you're watching this again, there's such vital information in this talk tonight. Just so important. The topic of infertility is just been on the rise, both for the female and the male aspects. And so you're going to hear a lot about this. This is a really important topic if we want to keep populating the earth, right? This is very big of having children and bringing new life. And so I'm super excited for all the speakers here tonight to be able to just share everything that their experience and their knowledge with all of us. So we'll be very blessed to be able to hear it tonight. And I'll just, put a caveat on there. Every story is very unique. Every body is unique. So we're not here, to take place of your doctor's advice or anything. However, each speaker that's going to be presenting, they are professionals, and they have in their fields of expertise. So what they have to share is very important. It's a lot of them practice, it's very evidence-based. And so, yeah, I just want to boost them up on everything that they're going to be sharing with you tonight in each of their fields. So I'm going to go ahead and be quiet, and I'm going to let each and every person, the first speaker, I'll let them all introduce themselves, what they do, and then share in their fields how we can help with these infertility issues to be the healthiest that we can be. So I'm going to go ahead and toss the mic over to Trina. So Trina, go ahead. You can unmute yourself, put on your video, and take it away.
Hi, everyone. My name is Dr. Trina Winter. Thank you, Lauren, for that wonderful introduction. This is something a lot of us are very passionate about, talking about preconception health and fertility. So a little background on myself. I am a doctor of physical therapy and have been for over a decade. And in the last probably good handful of years, I've specialized more in fertility. And most of my training is in regards to the optimal pelvic health, but also preconception and fertility nutrition. And I'm here to share with you some just different tidbits from my end and what I do to work with clients, and just giving you guys some tidbits of what we can do to really maximize our preconception health. I'm going to go ahead and share my screen because I have a couple of really good slides that I'm going to share with you, because I really think just a picture is worth 1,000 words for sure. So let me get this. I'll open this up. Okay. Can you see the slides here?
Yep, we're good.
Okay. Perfect. Just want to make sure it works. So first off, just kind of going through some of the statistics, and you can read a lot of different sources that share a lot of different statistics. And really here, this is just trying to show you how common infertility is. And it can go anywhere from, you'll see ranges of 1 in 6 couples to 1 in 8 couples. And recently, in the most recent statistics, it's really closer to 1 in 6. So our fertility statistics are getting a little bit leaning on the side of more infertility. And if you see in this top corner here, males do contribute to at least 50% of the overall fertility cases, and they're really solely responsible for 20 to 30% of them. So I really want to touch on that a little bit, because a lot of times what happens is us as women and females, we feel like it's our fault, and we feel like everything is in our control to help our fertility. And really what is important here is the male factor fertility. And that's one of the things I've been trying to share and work with my clients a lot more on, is the male factor. And we'll kind of talk about a little bit of what we can do for that too. But I really just want to hit home that it's both the male and the female. And if we're struggling with fertility, and we've had testing ourselves as females, they've looked at a lot of different things. We want to really make sure our partners, our males and husbands, are getting sperm tested and getting that semen analysis and seeing what that shows. And just because that semen analysis may come back okay, and they're like, oh, yep, everything's good there, we still want the males to be really living a whole food nutrition and really optimal lifestyle, because that can really improve the health and the quality of the sperm, which is also going to help with the health of the pregnancy and health of the baby. In regards to male fertility, these are some of the factors that can really play a role in sperm health. And this is something that starts from a very young age. So, those teenage boys, a lot of the choices they're making they're affecting their fertility down the road. And so, obviously, as we know with anything, as we get older, but then also our lifestyle. So obesity, alcohol and tobacco use, high energy intake, nutritionally poor foods, all of the processed foods we have in the standard American diet, recreational drugs, a lot of stress and anxiety. That's a huge contributing factor. There's also some genetic components. If anybody's had any testicular injuries or cancers, that plays a role. Some of these things are out of our control. But in regards to lifestyle and environment, we can control that. So control the controllables. Any radiation exposure, tight-fitting underwear, recurrent hot baths or saunas. If we have our cell phones in our front pocket, so I tell all the males, get their cell phones out of the front pocket. Don't let the iPads and the laptops sitting on the front side of our pants, and really just trying to not overheat the scrotal area can be really helpful. In regards to female fertility, because we do have a lot more parts and contributing factors than males, there's a lot of different areas here that can cause and contribute to infertility. So whether there's ovulation issues, so if somebody has PCOS or we have a thyroid issue going on, maybe some ovarian insufficiency, diminished ovarian reserve, we can have complications from various surgeries. So if we've had our appendix taken out, our gallbladder taken out, if we've had any laparoscopic surgeries, if we've had, endometriosis surgery, those kinds of things can play a role, or even secondary infertility if you've had a pregnancy and you've had a C-section. All of those different surgeries can play a role in the pelvic health, and we'll touch on that in a little bit. Any structural issues, endometriosis is very common. Hormone imbalances, a poor diet that's lacking in very key nutrients. If you have too much body fat or actually very low body fat, so or athletics overtraining, they kind of go hand in hand. So what I find is some of the females coming in, they're very, very, very thin, and they are really highly exercising, and they may have a history of not having very consistent periods, and that contributes to our fertility as well. If we have a lot of stress, depending on our environment, and diabetics, when we can't control our insulin, and we may not have the full-blown diabetic diagnosis, but when we have blood sugar dysregulation, that also contributes to fertility issues. So for me, since I dive into more of that pelvic health, I'm a pelvic health PT, I look at the health of the pelvis, and we're looking at those pelvic organs, the uterus, the fallopian tubes, the ovaries, your bladder health, your bowel health, your digestive health, all of those things. And I really go deeper into our breath work and how we're breathing, and things like that. So one of the trainings that I have, it's called Mercier Therapy. And I have a couple other different trainings as well, but in a sense, it's really the root cause here is really looking at that deep pelvic organ mobilization. So again, looking at those pelvic organs, it's helping to restore blood flow to improve function to the organs, but also relieving any restrictions around the surrounding structures. Our organs are made to move and slide and glide upon each other, and that's going to give us the most optimal digestion, the optimal bowel and bladder health, and optimal pelvic health in regards to just the oxygen and the nutrients and the blood flow to all those pelvic organs. So that's where those structural issues come into play, and that's where the history of any type of pelvic surgeries comes into play as well. So that reproductive organ immobility can contribute. So if you've ever had the diagnosis of unexplained infertility, like everything else looks like a picture of health, your periods are looking great, it looks like you're going to be ovulating, your timing of intercourse is perfect, blood work looks okay, all of those things. This can be a key contributing factor. And it could be just because we're having so much stress and we have just restrictions and tightness in our pelvic floor and our pelvic organs. That can also contribute as well. And so, like I said, all of those organs should move against each other, and seeing a pelvic health therapist that has this specialized training can be really helpful. So it kind of goes in here. I'll let you guys kind of read through those slides, but that unexplained infertility can come from that mechanical perspective. Again, when there's a physical obstruction preventing the sperm and the egg from meeting, whether it's in the fallopian tubes, or, maybe there's pain with intercourse and we're really tensing up our pelvic floor, we're carrying a lot of tension in our pelvic floor. There's not a really free flowing path there for the sperm and the egg to meet. But then also if they do meet and they fertilize the egg, we have to have a really healthy uterus and uterine lining with optimal blood flow for a nice home for that fertilized egg to implant. And if we don't have that, then we can have that really like chemical pregnancy, early miscarriage as well. And so that pelvic floor physical therapy, there's a lot of really amazing evidence that have recently come out that has been proven to help reduce these infertility causes. And it can be really, really helpful just to help with hormone dysregulation. It helps with painful periods. It helps with PCOS, reducing any type of pelvic pain as well. So we have all these conventional options, and it's just amazing to realize that something so whole body approach, so integrative, that can be really helpful is the manual therapy that the pelvic health therapists have. And so this is just some particular studies that are really specific to Mercier therapy. There are other studies that dive into just some pelvic mobilization, but it's an 83% pregnancy success rate. And I think that's really phenomenal and really amazing. It can be really helpful to, even if you've had a C-section or if you've had endometriosis and you're having surgery to remove that. All of this type of therapy can be incredibly helpful. So a lot of people will ask, like, what are my top tips? Like, what can we do? We're trying all the things, we're doing all the things, right? So some of my top tips, and I know each person after me will kind of touch on some of these too, but really just having a really proper nutrition, proper hydration, really eating, focusing on really whole food, nutrient dense foods. There's no magical fertility diet that, they talk about fertility foods and follow these specific diets. That can cause a lot of stress on our bodies, and we could actually be decreasing the amount of nutrients we get in our body if we start eliminating a bunch of things. And so we really want to focus on that whole food nutrition and the antioxidants. And really one way to get that in addition to food, is something that I take, is called Juice Plus. And that can be incredibly helpful. It's just like an addition. It's not to replace anything by any means at all. But it's just a really addition, because there's a lot of good research that talks about the antioxidants, which is going to help decrease the oxidative stress on not only the female, but also the male in regards to the egg and the sperm quality. We want to work on balancing our blood sugar, incorporating cultured foods, limiting alcohol. Alcohol is a huge contributing factor to infertility. Optimal sleep hygiene. I don't know how many people I talk to that do not get the optimal amount of sleep. We want to be getting anywhere from 7 to 9 hours of sleep. And if we're not getting that sleep, that right there is the first thing that I would focus on, is getting that sleep. Trying to get morning sunlight in the morning, having some breathing and quiet time, drinking your coffee after breakfast. That's a really important thing. Try to limit screens, your phones, your computers, your TVs within 30 minutes of waking and an hour before bedtime. Helping to manage your stress, finding strategies to decrease your stress levels and manage them. We can't avoid everything. We're going to have stress in our life, but what are we identifying as our stressors, and what can we do to manage that? And exercise that is right for you. I know in a little bit we'll hear a lot about exercise, and there is something as over-exercising too. So we have to find the exercise that is right for you, and even if that just means some gentle walking. And trying to avoid some endocrine disruptors. The biggest ones are fragrance and plastics are the common things right there. So again, really focusing on these top tips right here are some really key things that you can be doing for your health. And, in a nutshell, that's exactly what I work with my clients one-on-one with, and we share all of those things, and we kind of really brainstorm what works for them and finding an individualized care plan for them as well, and collaborating with any other practitioners that they have on their team. So, and if you have any questions about that, you're welcome to reach out, and we'll turn it back over to Lauren. And thank you very much for joining us, and we look forward to hearing the rest of the speakers.
Thank you, Trina. I love just what you said. I think, it can be so much more complex in fertility than just, A, B, and C choices. There's so many different things. And I love what you shared just from a physical therapy standpoint of it could be something physically that's blocking that. It could be something that we're putting in our bodies or that is affecting, our partners, just with the tight underwear and the cell phones in the pocket. So really, really great nuggets of information. Thank you so much for sharing all all of that. I'm going to turn it over now to Kristen. Trina had mentioned that we were going to hear a little bit more about the exercise portion. So Kristen is our guru in this aspect. So I will have her introduce herself, what she does, and she's going to share with us how movement and exercise also plays an important role in fertility. So go ahead, Kristen. Thank you.
Thank you, Lauren. I appreciate that. So, my name is Kristen, and I have been a personal trainer for the past 5 years. I really enjoy working with women, but I also do group training and really just have a passion to help people feel connected to their bodies and honor their bodies. A little bit more about my story and how I got into training. Right after high school, well, in high school, I was very active. I was in sports, and then right after I got into running pretty heavily for my first half marathon, and then also started doing weight training with it, probably more so than I did in high school. And during that season, I didn't really realize that I wasn't getting the proper nutrition and recovery that my body needed. And so I was really struggling there to have energy and feel good. And I also really struggled to have a healthy self image of myself as a young woman. So I was dealing with these different components of health, and some of the results of those, working out intensely and not having the appropriate recovery was I did lose my menstrual cycle for about 3 to 6 months. And typically when you lose your cycle, like, it can really affect a lot of things in your body, all your hormones. So like mentally and emotionally, things can be unbalanced. So I was really dealing with anxiety, and then just that self-confidence was really not there. So I got note cards here. So at the time, I was obviously not thinking about having kids, right? I was 19 years old and I wasn't really thinking about my future children, but I didn't realize, those things were affecting my future. And so later I'm going to share the turning point that I had, but I really want to get on the topic of exercise and fertility. And the question that I kind of want to answer is, does physical activity increase or decrease fertility in men and women? Trina hit on this a little bit, so some of her points will pop up. But there are just a few studies I want to hit on, and one of them is on women. They did an Oxford study in 2009, and what they concluded was that increased risk of infertility was only found for the small group of women reporting the highest levels of intensity. So that means aerobic activities for 60 minutes every day that are like high intensity. So not many of us actually fall in that category, which is why it was a small group, but the percentages were much lower in terms of their fertility health. What's funny is that they also showed the luteal phase alterations, which may lead to infertility among recreational runners with at least 2 hours per week of like other exercise and running 32 kilometers a week. Showed decrease in fertility as well, which that literally describes me when I was 19. My menstrual cycle was altered. I was a runner and I was probably exercising, doing other stuff that is 2 other days a week. So I'm living proof of that study right there. And then another conclusion is that it's possible that normal weight women doing high loads of exercise, not coupled with increased energy intake, so like nutrients and nourishment that our body needs, you're not meeting the requirements your reproductive functions need. This can explain the increased infertility among the women doing the high intensity training, which it makes sense. So it's not just the high intensity, but it's not applying your body's needs for energy and nutrients. And then last thing that's kind of hopeful with this study is like, if you do high intensity training and you're struggling with infertility, it's not too late to reverse that. They actually showed a trend of having 3 or more children during the follow-up among the women who reported having the highest levels of physical activity. intensity. And so they did a little bit of digging, and the explanation they thought could be from that they adjusted their activity level, or maybe by having that first child, it kind of balanced out their hormones so then they could later conceive. But that's not really concrete, but it does give you hope, if you do the high level intensity training. So exercise recommendation, in the study, it showed a healthy fertility range in women who actually did little to none, which I wouldn't recommend doing nothing, all the way to 30 to 60 minutes, 2 to 3 times a week is like a really safe spot to live. I'm not saying you can't do intense training, but maybe it's not every day. And if you do every day, maybe it's not to exhaustion. So there were those different variables that showed a difference, which I really liked seeing. So let me see if there was anything else on that. So moving, it's not only working our physical body, but it's also our mental body. And that was a big piece of my story. And as I was just thinking about women struggling with fertility, like moving their bodies might be really hard for them because they might feel bad about their bodies. And so, as a coach, really being sensitive to that is important. There was a Fertility Society of Australia who did a study on the role of exercising and improving, I'm going to pull something up here, fertility, quality of life, and emotional well-being. And so the studies indicate that light or moderate intensity exercise improves quality of life and emotional well-being. Among infertile women, exercise is a part of a lifestyle improvement program, reduce symptoms of anxiety and depression, and improve self-esteem. In women with PCOS, exercise improved health-related quality of life and reduced symptoms of depression and body image distress. So a lot of these things may come up with women in this season of their life because they're already in a sensitive spot. And so it's such an opportunity for them to really let go of those stresses and those triggers and really heal on a deeper level. So it's so much more than the movement there, which I really love that study. And then I just want to hit on this really fast. This is a call about fertility, but I just wanted to say the benefits of exercise during pregnancy have shown decreased gestational diabetes, preeclampsia, cesarean birth, postpartum recovery time, shorter duration of labor. Even the American Journal of Obstetrics and Gynecology showed that the duration of labor was significantly shorter in patients with higher levels of physical activity. So going back to the previous study that showed women that did literally no physical activity, it's still important to move because looking forward, you're going to want to have a healthy pregnancy and a good postpartum and delivery experience. So definitely loved that one there. And then lastly, moving on to the men. I can't leave the men out. So there was a study done with men in the World Journal of Men's Health. There's a few things that were put together here, and actually this year, and it's pregnancy outcomes and pregnancy outcomes and semen quality. So according to existing studies, sedentary behavior contributes to male infertility. The preclinical studies demonstrated mixed benefits from exercise, with diet being an important consideration. So basically, it showed that physical activity improves semen quality, but more intense, strenuous activity negatively affects semen parameters. So again, same thing with the men. Too much strenuous physical activity is not going to be good for the fertility goals. And then the last thing I'll say on this, which is really interesting, is they showed that specific physical activity for men, like cycling, over 1.5 hours per week, had 34% lower sperm concentration than those who did not. And so their conclusion of that was that, it could have been from systemic inflammation or scrotal heat, which goes along with what Trina said with the tight underwear. I totally forgot that she said that. So I just thought that was pretty astounding because I know a lot of men who cycle. So like that is something specific, which is really a really cool takeaway. So turning point, coming back to my story, how did I control the inflammation and hormonal imbalance in my body? So Trina talked a little bit about Juice Plus and how it's super effective just to get more nutrients and whole foods in your body. And so that was the one simple change that I literally did. I started taking all the plant powders that are in a capsule. It's real food. It's a variety of 35 fruits and vegetables and berries in a capsule. And literally my cycle came back in 6 weeks time after taking Juice Plus. That was the only thing that I did different. And slowly as I was taking it, my cycle was coming back. And so that's just like the proof right there of just eating consistent, real food that gets into the bloodstream and at the cellular level, because inflammation is it's the root of a lot of our troubles. So that's why I love that so much. And then it's also been a catalyst for me to inspire other women to love their bodies and to honor it and to be nourished on a deeper level. So, I had a few other points, but I think I should wrap it up. But moving forward, we all know somebody that might struggle with fertility, or maybe it's you, or maybe you're a coach and a trainer and you're working with somebody that's going through this. I don't know where my notes are. I have so many notes over here. So yeah, I think if you're that friend, just encouraging them indirectly is a great way by inspiring healthy, supportive activity, whether that's like, hey, let's go for a walk in the park and just enjoy nature, or hey, do you want to do a workout together? Because a big part of this journey is more than just like doing all the right things, but it's like having that deep support and love. And like love is is such a key ingredient to this journey. I know we're talking a lot of science and a lot of facts, but like love and community is such a healing, it's just such a healing medicine that I don't think we realize on the doctor side of how impactful that can be. And then if this is you tonight, maybe exercise is an area you want to explore. It is more than physical movement. So just thinking of it as just a time to connect with your body. One of the things that I started doing postpartum that I now do all the time, it's totally changed my perspective of exercise, is just to take time before and after every session. I don't do it every time now, but to just breathe and connect with your body. Maybe it's just speaking positive things. A lot of times, I know women struggle feeling like guilty, and just really speaking positive things over your body and speaking truth, that your body was designed to bear children, your body was designed to bear life, and that like you are seen and you are heard. Just all those positive affirmations are just monumental to just this process. And so it's not just a workout, it's so much more. So I think I went over my time, but that's it.
Thank you, Kristen, so much. No, it's really good information. I think that a lot of people don't realize that infertility and fertility can be affected by your exercise. And I think it's surprising to think of too much exercise, right? Because we know movement is really good, but thinking if I'm doing too much, that could also affect it. However, I don't want to discourage those who are big exercise fiends like me. I was a college athlete. I was a track and field. I was a heptathlete, so I did 7 different events. I would have 2 different practices a day plus lifting. However, I also am a testament to really taking care of my body, giving what it needed in order to keep up with that demand. I'm very grateful to have two children and not to have to go through fertility issues, but I do know applying a lot of these different things gave my body the best chance to be as healthy as it could be and create the best environment I could for future children. And Juice Plus was also part of my story. I was a bio major in college, so seeing at that time it wasn't as many, but now there's over 40 peer-reviewed scientific publications proving that Juice Plus does what it says it does. And like Trina said, this is not a magical pill. We just know, especially nowadays, we just don't get enough. We have so many demands on our bodies that we have to give it an additional boost, so to say. And so I think that was also a big part of me being injury-free as a D1 athlete, especially as a runner with a lot of repetitive motion and very high intensity workouts 5 days a week, and then with season 6 days a week. But our coach was always really big on rest, and I was too. Recovery, getting in the training room, doing what you need to do, the stretching, the breathing, the ice baths. And for me, being injury free and keeping my body healthy, I think was largely due to just really good nutrition, because your body has to pull from something, right? And when we're creating new life, it needs building blocks. So adding additional whole food is just so vital. And I know you're going to hear that a little bit more. I think Sarah, our next speaker, she's going to touch a little bit on it. She is a great testament. I don't want to take away all of her story, but just with different health issues and age, that could have been a factor to think like, well, I get pregnant. But I'll let her share her story and also her profession. And so Sarah, if you're on here, go ahead and you can join us here and unmute yourself and get your video on.
Hi, Lauren. I don't know if you can see me yet.
Not yet, but we can hear you.
Okay, it says I don't have control of my video.
We'll go ahead and speak, and we'll see if in the background we can get your video on, but go ahead and share away.
All right. My name is Sarah Rump, and I am an RN. I've been working in the critical care unit in a local ICU for several years, but I have a huge passion for just working with people on whole health, nutrition, just claiming what you want your life to look like and not settling into any type of diagnosis or something a physician may have told you. I'm going to talk a little bit about advanced maternal age and what a geriatric pregnancy may look like. And by definition, geriatric or advanced maternal age is any age 35 or older that is pregnant. So my story goes back to when I was 19. I had been diagnosed with celiac disease, which is considered an autoimmune disorder. And with that comes a lot of worries and fears being at such a young age as you learn more about the actual disease itself, how inflammation takes part and how it can continue to break down your body systemically. And so being only 19 at that point, I was worried that am I going to have issues with infertility later? And as my story continued, I knew that I needed to do everything I possibly could to focus on my health and live the most active life that I could while I was working full time as a nurse and trying to plan each year for not knowing what the future may show or not show. So I had heard early on that celiac disease could cause infertility. And one of the first things I claimed was that that wasn't going to be the main focus of my life because I didn't want it to take away my social interactions or change how I look at my future for relationships and dating and going out of the house and things like that. But not only was I year by year getting older, and based on my relationship status and just the unknowns with having an autoimmune disease, I started really trying to take hold of my mental health and not let it take control of putting me in a negative state of the what ifs in the future. I didn't want it to be the be all and end all of what was going to happen to me. So I really started eating healthy at that point. I started focusing on some whole food nutrition and just really more aware to what all could happen to my body if I didn't start staying active and working harder. As you start aging, if there's anybody else on this call that maybe thinking these things, you don't know if you're infertile because you just are in that stage in your life yet. but you also have other health issues, and you may have been told that because of your weight or because of a past injury or a past cancer or surgery, you probably won't be able to have children. You really just want to surround yourself with those like-minded, healthy people who are going to support your goals and your desires of what you want for your future. And that's what I started doing. I got really in tune to what my whys were and my what ifs of the future, and became as educated as I could and my own advocate, and started surrounding myself with those moms and the medical professionals who were in alignment with my beliefs and not telling me the negative thoughts. I really believe having that healthy mental state and a strong faith is what carried me through a lot of those things. Knowing that as you age, a geriatric pregnancy has a higher risk of needing to have C-section births. You have the risk of chromosomal abnormalities such as Down syndrome, higher risks of low birth weights and fetal loss, as well as preeclampsia or really high blood pressure during pregnancy, as well as gestational diabetes. So the CDC in 2014 has said that the number of women who are giving birth between the ages of 35 and 39 had risen continually each year. And since the 1970s, which I know seems like such a long time ago, more than 6 times more common now to have a birth with your first child when you're over 35. So I know several of the nurses I work with that have been career minded and gone after their master's degrees and things, haven't had their children until they're in their 40s, and they've all been very successful with staying healthy and being able to have, that positive outcome that they've always wanted. So going back to eating healthy, as you heard the other lady saying, being in my 39 when I was able to get pregnant, that I've always had a very active, outgoing life as far as being at work. You think, okay, I can't get to the gym 6 days a week because I work in an ICU for 12 hours at a time, but we're lifting patients, we're turning patients, we're pushing ICU beds down to maybe a CAT scan or an MRI, things like that. You're walking up the steps in the parking garage to get to work every day, and I work on the 11th floor. So all of those little things are considered movement and exercise. So I tried to not think about the things I wasn't doing as much as focusing on what I was already doing and how to make that work for me and my lifestyle. So that with really trying to support other people in the same areas was huge for me. I wanted to heal my gut from the very, very beginning when I was diagnosed with celiac disease, because I knew that and focusing on the microbiome was going to take an overall effect on the inflammation, as well as using the whole food nutrition that these other ladies had talked about with Juice Plus. Very quickly, my health had turned around after several years, almost 20 years of living in that chronic pain state and inflammation. I was able to get my health back pretty much within 6 months. All of the pain and inflammation, bloating, foggy brain, acne, migraines, all of those things had completely gone away from me. So I knew that as I was getting older, it could only help my chances of a healthy pregnancy and the ability to have children when and if my life got to that point that I'd be able to do that. So when I was 39 and I was married and was able to get pregnant, and I had a very healthy pregnancy. A lot of the women I worked with didn't really even know I was pregnant. I didn't really tell anybody until I was about 22 weeks. And when I didn't ever really lose my energy, I didn't have the normal aches and pains and problems that you see sometimes with unhealthy pregnancies. And I just had implemented all of these areas that these other ladies had talked about. And I've had a history of other, problems with risks of cancer. When I was young, ovarian cancer, and had to have several procedures done. So there was always that risk of scar tissue on top of my celiac disease diagnosis. So knowing that my health was completely transformed year after year by just adding that positive, good nutrition only helped clear my mind, and never letting myself get into that negative place of not being able to have, children. So I really want to say, just learn the myths and the truths about what your body is capable of. We're designed to do amazing things, and your body was designed to function as you want it to function with the health and support of other people. So I don't get into that negative spot like they were talking about, really support each other, get into a healthy network so that when you are thinking about starting to do family planning, or you're in your beginning stages of pregnancy, when you can have those positive thoughts, then you're only going to be able to carry them through the pregnancy and into those early postpartum stages. And that's a piece that I think is huge too, because if you're going into pregnancy in your 30s, and for me, my 40s, it's a total life changer. I've had a career driven life my whole life, and then marriage later in life, and children later in life. So I have one almost 5-month-old baby now, and it is a game changer for how you live your life. So if you're not having those positive support group and the healthy mental states when you are in your postpartum stages, and not being able to do the things that you could just do every single day, and go out to work and working your 12-hour shifts and running up and down the units and going out and meeting with your friends, it can really shift your life. So having these healthy boundaries and healthy things in your life beforehand can really carry you into these stages a lot more positively. So one of the other things I did along all of that with the changes was I learned more about my body. I also made small changes, one thing at a time, as far as using cleaner products for my makeup. I cleaned my house with cleaner products, or with just water and some microfiber cloths. I started just making the environment I was in more healthy and clean, so that as I was able to go into trying to have a family, my hormones were more in balance. The environment was cleaner and safer for myself, and then to bring a baby in as well, it wasn't as overwhelming. So putting all those things into practice really made a positive impact for my life, and I think it could for a lot of other people's too. So hopefully this helped a little bit. I know it wasn't exactly on the same line as what the other ladies were talking about, but I think there's so many more people that don't know 100% about infertility just because they haven't gotten that stage in life yet. And don't be afraid to have a family when you're older, if that's really what your goal and your dream has always been.
Thank you, Sarah, for sharing. I love your perspective, and just, yeah, your story is such an inspiration for so many, because I think, yeah, a lot of times we write ourselves off, right, because of a diagnosis or because of age or whatever factor. But you're living proof, right, of all these things, despite that, the consistent things that you did in your life, various things that keep your body at the best shape and the best health that you could be, really, really was beneficial of being able to conceive and to have full term pregnancy, and now birthing and caring for a little one. So thank you so much for all the great nuggets that you shared as well. All right, I am going to turn to our last speaker. Jennifer, you have the floor for the remainder of the time, so you can go ahead and introduce yourself and just everything that you have to share for us. Thank you so much.
Hey, everybody. My name is Jennifer. I am a registered nurse. I work currently as a doula. I do craniosacral therapy, and I also do lactation services. So these ladies hit the nail on the head, I think, and that the way we approach our body comes from many different angles and aspects. So my biggest takeaway of hearing all of these speakers tonight is that it is a multi-system approach to our bodies and to fully heal our bodies. So what I want to share with you is, from my perspective of being in the healthcare for so many years, I worked in the hospital for 10, and I've been out of the hospital for like 5, that all of us in the healthcare field have been trained completely different. We have a foundation that is much similar. It's maybe a solid foundation of knowledge, but where we go from there afterwards is really what makes us unique in our field and what we do. So if you're not getting the results that you're wanting, don't be afraid to go get a second opinion or a third opinion or a fourth opinion, because every practitioner works completely different. And I think you should have grabbed it here, is a mind, body, spirit approach is really the best way to approach a body and heal a body. I mean, we can throw all the supplements and nutritional facts at you, but if you're under a tremendous amount of stress, or like Kristen said, you're stressing your body out because you're working way too hard, we can supplement like crazy, but we have to eventually deal with the stress. So that's one of the things I've learned through my journey of being a nurse as well, and kind of working with so many doctors, is seeing the diversity that is in each doctor and how they approach the human body and the issues that are arising. And I want to leave you with this. Currently, I have a couple doula clients that one doula client is delivering. They're both in the next couple months, but one of them is delivering in the hospital and one of them is delivering at home. And it's really intriguing to see the differences of the way they're both being approached in their pregnancy. So the one girl right now that is delivering at home had a lot of questions about her blood sugar and she just felt off. And her midwife guided her to check her blood sugars more on a regular basis and see how they were, even though she did the glucose testing and passed it. She said, why don't you watch your numbers and see if you can pick out a correlation? And they reviewed nutrition and food and pairing of foods to help her blood sugar. I have another doula client, the other one that's delivering in the hospital, voiced the same concerns to her practitioner. Her practitioner just said, well, you passed your testing, so your body should be fine. But this mom, what's kind of cool about her is she delivered with a home birth midwife last time and knows there is more she can do. So she's reaching out to now a different practitioner to dive into nutritional training a little bit more to get more specific. And also the way in which we read normal lab values is completely different from practitioner to practitioner. There's a basic levels that are out there that on your lab results say within normal range and it's green to the side. But all practitioners read those levels differently as well, and kind of take away a little bit of what they mean as different as well. So when I worked at Wilson, we actually had Dr. Courtney Slonkoski that worked there that specialized in infertility. And she would work with many women for several months on diet, nutrition, and supplements. And then if they weren't getting anywhere, she would refer to a doctor here in Lima that he is very old school. And he said he's been practicing since the 60s, I do believe. He said that we've been changing throughout the years what normal labs are. So what is normal in the 60s is no longer being considered normal now today. So I just want to leave you with some hope that everybody practices differently out there. And like Trina said, it's a team approach. I think you heard that in everybody's conversation today, that that's a team approach. And what connects all of us women is the community of Juice Plus, is the product of Juice Plus. It's whole food. It's fruits and vegetables in a capsule, nothing synthetic. And your body knows what to do with whole foods. So I started taking Juice Plus after my kids did, and I actually noticed changes in my period, in my regularity and PMS and things I thought were normal in my body as a woman, and working in women's health. Actually, I saw all go away with taking Juice Plus, and I was a super healthy eater prior to taking it. But just like Kristen said, by adding in that one good thing, I noticed difference in my body. So that's why I share it with so many people. I would tell you I'm probably the healthiest person I know. Even before taking Juice Plus, I was very a clean eater. But by adding in that one simple thing, I noticed changes in my body. So I can't help but share the message with everybody else. So thank you, ladies, for putting this talk on tonight. And Lauren, I'll hand it back over to you.
Thank you, Jennifer. Yes, you couldn't have said it better. It is a holistic approach, and fertility and pregnancy and all of the things and just everyday life, right? Not just for wanting to create and sustain life, but also just our own life, right? And so, yeah, I can't say thank you enough to each and every speaker and just sharing their profession, their knowledge. I don't want anyone to feel overwhelmed, like I've got to do all of these things. Just start with one simple change, just like Jennifer said, whether it's adding one simple fruit and vegetable capsule, whether it is working on breath movement. You now have a list of practitioners here to start just with one thing. Okay, let's focus maybe on the physical side of my body and go from there. So there's a lot of different avenues, and I think that does bring us hope. I hope it brings you more hope as instead of being overwhelmed, of knowing that there's a lot of different reasons maybe why myself or someone I know are struggling with fertility issues. And so that's great. It's not just, well, the doctor said everything's fine and that they don't know why that I'm not being able to conceive. Well, hey, let's look at all these other things that each and every one of these ladies has shared. And I think that's a great thing, but start simple, start just making the first step somewhere. And if you want information or you want to get connected with any of the speakers, please reach out to the person that invited you to this call. And we would be glad to answer more questions, to guide you to different places that might be beneficial for you. Anything we can do. We just want to support you and share this message of good health because we all deserve to have good health. Our future children and grandchildren and everyone that's going to be brought into this world, God knows, we all deserve just to be the healthiest that we can be. So thank you again, everyone, for taking the time tonight, and hope you guys all have a wonderful rest of your evening.